healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We're so excited for this episode. We're bringing back a return guest, Dr. Kimberly Souffront. If you didn't watch her first episode on asymptomatic high blood pressure, make sure you go back and watch that. I'll put that link in the description box. It was a bit of a heavy topic, but today we're going to get into her nursing journey and her perspective on the landscape of healthcare. She comes with a long list of credentials, and I think it's going to be really informative. And this helps us meet one of our other objectives with the show, which is to elevate the platform of nursing and to inspire the next generation. And I think you're perfect to do that. You're our first PhD as well. And so you really helped me check all boxes at one time.
Oh, good.
If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and I'm one of your co-hosts here at the Melanin Initiative Podcast, along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe so you can be notified when we release a new episode. And by the way, I've gotten some few questions. So if you're new to YouTube, you've never subscribed to a channel, you just look below. It has the word subscribe. There's even a bell you can hit so you'll be notified when we release new episodes. And they'll be under your subscription tab. If you haven't already, thumbs up the video, leave a comment or two. It lets YouTube know other people who need to hear this information, who are pretty similar to you, that when they log in, they'll see this immediately on the homepage, or when they search topics, we'll be higher up on that list of results. As a reminder, the show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone else you know might be having a mental health emergency, you should call 988. Okay, Dr. Souffront, welcome back to the Melanin Initiative.
Thank you for having me.
Yeah, this should be really fun, a little bit lighthearted. So let's hear your nursing journey. What inspired you to get into nursing, and is that where you started?
It is where I started. I went pretty traditional out of high school. When I was 18, right? I went away to college. I did a traditional program for my bachelor's. I went to school in Boston,
Oh,
Northeastern. Are you from there?
my parents met there, and
No
my
way.
love bug just got his doctorate from there. So yeah,
Oh,
very close to our family.
yeah. So I graduated from there a long time ago. Um, uh, and as you know, it's a 5-year program, or for me at that time, it was a 5-year program. Actually, it wasn't. So it was a little unique in that way. We had co-ops. Are you familiar with the co-ops? So
Oh,
the
at Northeastern, yeah, at
yes,
Northeastern, yeah.
yeah. So we worked full time in the
But the audience
hospital,
might not be, yeah.
and and then you kind of go back to it's quarter system. So you work full time as a student nurse, go back to school, and so that's why it was longer to be 5 years as opposed to like 3 or 4. But through those co-op experiences, you were allowed to kind of work where kind of figure it out where you wanted to work. I worked in med surg, in the surgical ICU, a number of places, and then I landed in the emergency department. And I honestly haven't left. I mean, I think now I kind of work more in the urgent care space, but really that's an extension of the emergency department. But that's where I've been. I finished my bachelor's in 2001. I became a nurse in the ER, and then went on to, I wanted to do more, right? And kind of provide more total care as opposed to, what we did in the emergency department. I wanted to kind of just do the whole picture. So I went back to school to be a family nurse practitioner. I went to Pace University. And of course, my first job was an emergency NP. So I've been, working in the emergency department for some time. But it was through those clinical experiences as an NP that I realized everything we're doing is based on research. Everything we're doing is based on evidence, right? And that, and through some other clinical experiences, really pushed me to do my PhD, which I completed in 2013, and then did a postdoc in 2014. But I've been in that research academic space since then.
Where are you from?
I grew up in Long Island, New
Mm.
York. Yeah, my parents are Jamaican.
Oh,
Born and bred. They came over, I don't know, when they were like 18 or so. So we're all first generation Americans. I'm one of four.
just like
Yeah. Yeah, I'm one of four and have four.
Oh, that's cool. And was anyone else in your family in healthcare?
My mom is a nurse. My grandma was a midwife. My
Oh.
godmother was an NP, and that kind of guided me. My brother and my sister are actually both physicians, but I have other like cousins and uncles and all of that. So yeah, to answer your question, there are a lot of healthcare people in my family.
A lot. What do y'all talk about healthcare on the
I
show? Oh my
know,
goodness.
right? Like, what do you talk about other than healthcare? My husband's
What
always like, "Do you know anything other than that? Other than asymptomatic hypertension?"
what about your kids? Do they have aspirations to do other things outside of healthcare?
Yeah. Yeah, they do. I think one may be in healthcare, but the others are
Mm.
like, "Yeah, no."
And their specialties, anyone doing emergency care like you?
No, my brother is surgery,
Hmm.
and my sister's anesthesiology.
Oh, okay, kinda
Yeah,
okay.
and my younger brother, he passed away, so it's the 3 of
Oh,
us right now.
okay, sorry to hear about your brother.
Thank you.
And let's see, what was your motivation to do for your particular research area?
So, it's twofold. Right. So other than high blood pressure in the emergency department, I also do work around workforce diversity
Hmm.
and trying to increase the um, the pool of nurses, doctorally prepared nurses who are Black and brown. And so that came from my undergraduate experience, actually in Boston, realizing
I was thinking
that
as soon as you said that, I was very curious about that because
yeah, I
when
was
I
one of two. I was one of two Black nurses out of a cohort of more than 200, right? And
oh,
so witnessing that disparity, right, between the diversity of my cohort and then the community that we were serving was
mhm,
completely right. And so that was one motivating factor for some of the work that I do now. I was recently funded by the NIH to have a program for underrepresented minority DNP students to
mm.
provide summer training in translational research and EBP. And so that is one thing that I'm doing now. I have a lot of other ideas. But then my research, around high blood pressure in the emergency department, I mentioned on the previous episode, I'll mention here today as well, around a patient that I encountered, Mr. Johnson. So he was, a patient who was low acuity, going home, had very high blood pressure, casually told to follow up because he felt fine. And then 3 months later, he became my patient because he was experiencing a stroke. And so that was just one catalyst or motivating factor for some of the work that I do, but it really just highlighted a lot of the systemic issues with how we're caring for our patients in the emergency department. So that was a motivating factor.
So yeah, so growing up hearing my parents' stories of Boston, right? I grew up as a kid with my own Boston dreams. And initially I wanted to go as an undergrad, but my mom convinced me to stay in state so she would buy me a car. Long story short, she didn't buy me a car, I bought my own car. And so when I went back to grad school the first time, I said, I'm having my Boston dreams. And so I went to Tufts and I did their biomedical
Okay.
engineering graduate certificate program. But growing up, listening to, what we learn in school about history is it's like, the North was where everybody ran to. Everything was beautiful up there, right? It was a new world. So it was I guess it was cultural shock when I got up there and I realized
Wow.
so I always grew up in predominantly white environments in schools, but I never had to like look for people of color. But Boston was the first time I actually had to look for them. And it was very segregated, certain they lived across the tracks, it was very clear, these clear lines. And so that was really the first time I had that experience, the first time anyone called me, and the last time actually anyone called me the N-word. And so when you brought that up, I just completely related to that story. I do find it interesting that you brought up the DNP, right? Because when I was in MP school, I learned about this collaborative initiative to have more DNPs and PhDs work together. And the place I was working at in the newsletter, they said they had this DNP PhD collaborative. And so I reached out to the contact person, who's Dr. Danielle McCamey, the founder of
Yeah.
DNPs of
I just had
Color.
a call with her the other day.
And I just had a call with
She's
her
great.
yesterday.
Oh, yeah. She's amazing. She's doing great work. Wow.
So, yeah, I love what you're doing here, and that you have this grant and that you have ideas. I'm a big dreamer, my mind never turns off, and so really gonna follow your journey and whatever you're doing there, and I love that you're working with DNP students. And I'm curious, it doesn't sound like it from what I've heard, but did you consider the DNP when you were thinking of which direction to go?
I did not because I wanted to do research. And the DNP, from my understanding, it didn't change anything clinically, right? But it did open up a lot of doors around policy, around leadership, around uh, a lot of things with what's the word I'm looking for? I guess translational research, right?
Oh,
Just
yes,
being part
perfect.
of these,
Yeah.
being part of these, contributing members on these research teams. But in my role now as the associate director of our nursing research center, we anecdotally, there is a barrier to, a lot of these nurses were going to do their DNP, working with me to do their project, and then that was it. They didn't do anything else, right? They didn't continue it.
Mm.
And so we interviewed a number of newly minted DNPs, and a lot of the themes that came about were that they the confidence, there was little support with skills, time. They didn't have the time to do it, but they wanted to. They were very willing and definitely wanted to be contributing members on these teams, but needed more resources on how to actually do that. And so my colleague and I, Bevan Cohen, we wrote to we wrote a grant to the NIH, and sort of pitched this idea. And NIH has never funded something like this before. This is like the first of its kind.
Hmm.
And it actually took several years.
Oh.
Yeah, it actually took almost 3 years, right? So we submitted it, then you have to resubmit it. There's concerns, you address the concerns. It's a long process with writing grants and grant funding. But we were recently awarded last August, and so this summer we're recruiting our first cohort. So we're really excited about that. Yeah.
Wonder, is there a way we can follow along or where there'll be updates posted about what you're doing?
Yeah, so we have information on our website, the Center for Nursing Research at Mount Sinai. It's called the TRAIN program. It stands for Translational Research and Implementation Science for Nurses program. So we call it the TRAIN program. And we'll have information online. We post on LinkedIn or IG through the the work account. But yeah, we're just starting to onboard our first cohort, so we're really excited about it.
Wonderful. And so you spent a lot of your career in emergency medicine. What's your perspective on the current state of emergency medicine?
So that's a big topic. So I think now when we're talking about research, right, in the research space, I'd say there's a lot of work being done around like using artificial intelligence, AI, and using like phenotyping in the EHR to identify these patients who are at risk. And it may not just be high blood pressure, it may be, women's health initiatives, it may be a lot of other things. But to identify these patients who are most at risk to ensure that they receive the most equitable care. And it's delivered at that time. And precision health, right? We want to make sure that we're delivering not only precise care, but tailored to what patients need. There's also a lot around telehealth, right? Ever since COVID, telehealth has been around a long time, right? A telephone call is considered telehealth. But ever since COVID, right, it's now kind of like the way of life. But using it in a way that is digitally inclusive, so that not everybody has Wi-Fi and access to a lot of the apps and things that are really innovative, right? But in reality, they may not be useful to everybody. So making sure that our community that surrounds the emergency department can receive the care they need in a digitally inclusive way.
Oh, okay. Interesting. So, in case we have any students who are curious about research as a nurse, right? Because you said you teach, you still see patients, and you're in research, you're doing grant writing. Give us kind of this an idea of kind of what I guess that life looks like for someone who might be interested.
So I'll say that like in the beginning, right, when you're a new nurse, your focus is clinical care and, taking those tests and, checking the boxes and doing all of that, right? That's the priority when you're first coming out of nursing school. But as you advance through your career, you'll notice that it's more than, the caring aspect, and it's more than knowing that, you're part of these patients' lives at the most vulnerable moment. It's just bigger than that, right? Nursing has such a great impact, right? And that impact is something that I didn't know about when I was 18, but the impact is around research. It's around generating knowledge, and it's around influencing policy. Nurses do that. Nurses can influence that. But in terms of like my general day-to-day, I'd say 75% of the time I'm in that research space. And what that means is that I design studies to improve care, right? And so designing those studies may be, looking at the literature as what people are doing or what they're not doing and saying, oh, I could do it this way, right? So you want to write a study and a protocol, but you can't do research without funding, right? So you write grants, right? Yeah, you have to write grants. In academia, you write probably 20 grants to get one, right? And each grant probably takes 6 months to write. Like it's really, it's hard. I'm kind of echoing here. But that's a small portion. The other portion, I mentor. I mentor a lot of nurses and a lot of DNP students as well on their evidence-based practice projects, clinical staff. I teach them and provide resources for them around research and what that is. And research is such a big umbrella. There's so much involved, right? How to do a literature review, how to generate your question. What is your PICO question, right? How to, critically appraise the literature, how to design a study. What is a survey? What is a retrospective review? What is a prospective review, right? So we talk about all the nuances of research. And then I cross collaborate, right? I collaborate with people who are not in the emergency department. I collaborate with people who are in sickle cell. I collaborate with people who are in palliative care and geriatric medicine or oncology, women's health, right? So, there's always, in academia, we work in our silos, unfortunately, right? But each silo, like, you need expertise on specific content, right? So you could offer your expertise to many investigators across the spectrum, not just emergency care. And then about 1 day a week, I work clinically.
And this is in urgent care?
Right now, yeah.
Okay. And then with all this grant writing and all the lit review doing, do you have assistants?
Mm-hmm. I have a program manager. I have research coordinators as well who are, if I'm doing an intervention, they're recruiting patients in the emergency department. So, say there's a study that I'm implementing, you train them on the study so they know how to screen for the specific patients in the electronic health record. They approach a patient, deliver content about the research, obtain informed consent, do questionnaires or surveys or whatever with the patient. Research coordinators also not only collect the data, but they can organize the data as well. They even assist with writing, disseminating some of the work, writing abstracts or being part of manuscripts as well. So I definitely have, support. Have to have support. And then I have mentors. Like, you can't do anything without a mentor. Mentorship is like 100%. You need a mentor that's really invested in your growth. And wanting to genuinely see you grow and advance in your career. So I have a lot of support.
I love that you brought up mentorship twice. And so I would love to hear because it's my opinion that when we look at our physician colleagues, I feel like they excel when it comes to mentorship, and that in nursing, we're still kind of struggling a little bit to get nurses on board with why that's really important. So what's your pitch on like why mentorship is important for nurses at every level?
I think at every level, you need a mentor. You need a mentor to not only help guide you professionally, but I mean, you're a whole person, right? You're not just working in a hospital, right? So how to manage all of that and juggle all of that, you need help from somebody who's done it already. And not everybody is a great mentor. Not everybody should be a mentor, right? And there's a big difference between advising and mentorship, right? You want to make sure that someone is really genuinely, like I said, invested in your growth, and whatever stage that could be. In your undergraduate, it could be maybe graduate, postgraduate, whatever. But your mentors are kind of with you for life. It's not like a one-time transaction. It's a journey. It's a journey that you're on with someone that can help guide you professionally and personally.
And so where should someone start if they're looking for one?
So it really depends, So for me, one of my first mentors, her name is Deb Chun. She's from NYU. I sought her out because her work was aligned with some of the work that I wanted to do when I was looking for my PhD. And so it just, so I'd say find somebody who is aligned with you in some way, but don't expect it to be like, don't expect it to be a match every time, like it just happens, right? And if it doesn't happen, you can evolve, and you will be connected to other people as you go on with your career. But you have to seek them out. You have to seek them out, and you also want to know, like, if you're seeking somebody out, have they mentored? Do they have a established track record of mentorship, right? And if you see that, I think that would be a good fit.
Thank you. I want you to brag a little bit because I found you on LinkedIn, and there was a few things mentioned on there.
Okay.
One, it says that you're a Betty Irene Moore Fellow for Nurse Leaders and Innovators and Editor-in-Chief for the newly launched journal Practical Implementation of Nursing Science.
Yes.
Congratulations.
Thank you.
Brag a little bit. Tell us what that is.
So the Betty Irene Moore Fellowship is funded by the Gordon Moore Foundation. And so they award a 3-year grant to 10 nurse scientists across the country for 5 years. I was in cohort 2021. I'm actually coming to the end of my fellowship. And so you are connected with really phenomenal nurse scientists, many who are Black, brown, very diverse, right? Who are doing like amazing things in science. I mean, smart homes, artificial intelligence, work at the Mexican border, like really fascinating and just compelling work. And so we kind of go through this, fellowship, right, through the course of 3 years, and we are trained on leadership skills, and how to broaden your network and trajectory in science. I think they just recruited their last cohort. It was like a 5-year, a lot of money from the foundation over 5 years. But each scientist who's awarded this fellowship receives about $500,000. They get to, do their research over the 3 years. They, get protected time through work. They get a lot of resources with really great staff, right? So, and experts, experts in design thinking, right? Experts in business, like things that we are not exposed to in nursing, right? So we're exposed to all of that media, right? Training. I mean, so many different exposures so many things I've been exposed to over the last few years that I would not have been exposed to any of that had I not been in this fellowship. 100%. And a lot of the networking. I mean, the fellows that I'm connected with now, I'm going to be connected with them for life. Like we already collaborate on so many things, grants and programs. And can you give a talk for this? Can you, we really have a close bond. But that was really exciting because, it's only, appointed to 10 people, right, across the country. So I was really excited to get that award. The journal. So a couple years ago, the Levy Library at the Icahn School of Medicine approached me and my colleague about launching a journal. And at that time, we were really thinking about, all these nurses are doing such great things. Like they're innovative every day. They're implementing practice changes every day. They're translating evidence into practice every day, right? But they're not writing about it and they're not disseminating their work. And so the motivation behind this journal was to provide that platform for clinical nurses to share their diverse perspectives on clinical practice, but in a way that's not intimidating, right? Right. The publication process can be intimidating, especially if you're not in academia. So in a way that's not intimidating, it's free, right? It's free to publish, which these days is unheard of. Like these journals now cost like $3,000 just to publish. Like it's just the fees have been astronomical lately. So that was the motivation behind that journal, to really help our clinical nurses share what they're doing, because we're in New York, but there's somebody in California that may want to do the same thing. But why reinvent the wheel, right? So let's document and share what we're doing.
And then where do you fit that in your schedule?
I mean, I don't know how to answer that.
I know very few nurses, especially the longer someone stays in academia and advances education, that only do one thing. Like we're all out here doing all the things.
Yeah. I mean, I know it seems like a long time, right? I finished my PhD in 2013, my postdoc in 2014. It seems like a long time, but in science or in academia, that's not really a long time. Like, so I'm sort of still in the early stages of my career. I'm not like, I'm not considered like an early investigator, but I'm like early to mid is how they classify it. But so I'm just working hard. You gotta, just gotta climb that, I don't know, ladder.
I hear you. I'm on that I'm on that ladder with you.
I think we all are, trying to just do the things.
What would you like the public and current nursing students to know about healthcare and healthcare professionals?
I would say that, I kind of alluded to this before, that nurses are more than just at the bedside, right? Our impact is large, to say the least. It's huge, right? We know our patients the best. We know what works the best, right? And so we can drive science and we can generate new knowledge and influence how other people are delivering care through policy. So I want people to know that we're more than bedside. Our impact is really large, really, really large. We're in the White House. It's our impact is significant.
I think that's a huge point. I say that in using other words, but we have the same message, right? And I think it's really important for those aspiring nurses to hear that, because I think we come in with limited thinking on what we can do, right? And the fact that a lot of us start with taking orders, and you mentioned we work in silos, then we end up having to like undo that thought process, and a lot of that work is done through mentorship. But I it's my hope that if we catch them at the very beginning, they keep that open perspective and realize their limitless potential.
Yeah, absolutely. Yeah.
What's your vision for the future?
It's a vision. I would love a world where our workforce looked like the patients that we're serving, and our patients got what they need. Is that hard? Right? They just need just to give them what they need, especially in the context of emergency care. But my hope for the world is that we can achieve equity in health and healthcare, if everybody could just weave a thread of equity in everything that they're doing, a thread, I think we'd be in a much better place.
And what's the first step for that?
To achieve health equity.
Mm-hmm.
So not knowing to give people what they need. That's equitable care, right? It's not equal care. Like you can give a statin to, everybody on your unit because they just had an MI, but I don't know if I can pick up my statin. I don't know if I could, afford my statin. I have cultural, beliefs why I don't want to take the statin. There's so many social determinants of health that impact that. So it's more than all these quality metrics that we're, I have 100% compliance with this, or I have, it's more than that. You have to dig deeper.
All right. So what can we expect from you this year?
I want to, so, I talked about the program that I have for underrepresented minority DNP students, but I'm hoping to have a program for more novice nurses, either newly minted nurses, or even high school, kind of like that younger generation really start to mentor so they can see that, we're more than sitting at a bedside, or which is significant in itself, right? But we're more than, and we can have more impact. Obviously, looking for funding. I don't think that changes ever, but hopefully implementing new interventions in the emergency department to make sure that all our patients receive what they need, including blood pressure control, and better outcomes.
And just for my own curiosity, if you could do anything for free, what would you do for a living?
It's so funny because somebody asked me this the other day, and everyone was like, "Why would you want to do that?" So I want to save the world. I want to just donate my time. I want to help heal, right? Go to other places and help to deliver my expertise, right, and my knowledge in helping others. But doing that in a way that is, I could just bring my whole family with me. Kind of just travel a bit. Yeah, but it was funny because when I was asked that, everyone was like, "Oh, I'm going to sit on a beach. I'm going to do this." I mean, but I don't know what's wrong with me.
And so is this missionary work, like medical
Yeah.
missions?
Yeah.
Okay, have you had a chance to do that?
No, nope. I have not done
Hmm.
any missionary work.
And if the perfect missionary group was listening to this, what would those qualifications be?
That I could bring my entire family.
Yeah,
I
that's
have
it, huh?
my family's important to me, right? It's just, you have to find that balance between professional and personal. So I think right now, although my heart wants to do it, it's not, I can't just get up and leave for 4 kids and my husband, so if I could do it as a family, that would be something really exceptional.
Thank you for sharing that. I mean, they have 2-week opportunities, like summer break, it's possible. You talk to me, I'm gonna tell you everything. I'm a
Oh,
dreamer.
oh yeah.
So, yeah, I can always find a
Send me
way.
the deets. Send me the details.
So we'll put all your information in the description box so people who want to contact you can reach out. We can't thank you enough for spending your time with us, sharing your expertise, your vision for the future, inspiring the next generation, and all the work that you're doing to help our voices get heard and to also make sure the patient isn't lost in the shuffle of healthcare.
Thank you. Thank you for having me.
Remember, everyone, you can email us your show questions and ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends and rate us on the Apple and Spotify podcast. Leave a comment, really helps the show get more support and gets the message to those who need to hear it. You can find all of our social media links in the description box and any resources that we mentioned today there as well. We release a new show. So actually, with this season being season 3, we release our new shows that are our health literacy topics weekly on TMI Tuesdays at 10 a.m. But now that we're introducing these nursing journeys, these perspectives, and kind of bringing in more of the career aspects, we're going to be releasing these shows on Sundays when everybody's sitting at home on the couch looking for something to do. So make sure you follow, subscribe so you can be notified when those episodes drop. Once again, Dr. Kimberly.
Beautiful name.
I know, I love it. It was really a pleasure, and really, like I said, like I've been dreaming to do this ever since I found out there was this initiative. And when I was choosing to, when I went to nursing, when I chose to do nursing, I was a graduate research assistant at Children's Hospital Boston. And at the time, I was trying to go to dental school. But every morning to get ready for work, I was watching ER, and it just so happened that every episode centered around the nurse. And then I was going to work, and to recruit patients for the study, I had to talk to the nurses, and it just shifted my attention to them out of nowhere. And I felt so lonely in Boston, right? I'm alone by myself, and then I'm having this racial experience, this cultural experience, and I'm starting to see all the dentists that I shadow lonely too. So it all kind of happened at one time. And so I knew I wanted to go. So I picked out my doctorate nursing program before I even picked out the bachelor's program.
Oh, wow.
But at the time, the plan was to do the PhD DNP program. That was my plan. But then I got in the hospital, I got involved in the hospital, started to have a bigger picture of healthcare. And then I had other interests that were part of my priority in life. And I just thought, I've already dedicated all my adulthood to school. I don't want to devote that much attention. So I took an extra year to decide. And even before I left my bachelor's program, I talked to two of my professors, two Black professors at University of Memphis. One had her PhD, one had her DNP, just to get their perspectives and advice. Of course, they still pitched. They were very strong.
Of course. I'm going to pitch my PhD and you're going to pitch your DNP. I get it.
And then I just took that extra year and I just chose to do the DNP because I felt like I could still do research, and I mean, I just love research. And since I've graduated, a lot of my attention has gone there, and I'm still happy with my decision, but I love what you're doing. I love that I've had this opportunity to engage with you, and I really look forward to following your journey. And I just can't thank you enough for coming on here and sharing all your expertise. It's really fascinating what you've done and what you're doing, what you're continuing to do.
I can't thank you, enough for giving, people like us, a platform to share our voice and our work. So thank you.
Thank you, everyone, for watching. We'll see you next time.